What happens when an abnormal lab result isn't shared by the nursing home staff with the doctor? That's the story of what happened in this case that we recently settled. I'm Barry Doyle, and I'm a lawyer handling nursing home abuse and neglect cases throughout the state of Illinois. When the family came to us, the family told us that the mom had developed sepsis from a urinary tract infection, had to be airlifted from a local hospital to a medical center, and spent nearly a month in the hospital. The backstory was that she had a fall at home that resulted in a brain bleed, and she went to a local nursing home for rehabilitation. While she was at the nursing home, she developed a urinary tract infection. UTIs are a serious issue for senior citizens for a number of reasons. Most importantly, they can lead to sepsis, which is life-threatening, but short of that, they often cause delirium and weakness, which can lead to falls, which are also a serious issue for senior citizens. One of the many ways that nursing homes are different from hospitals is that doctors aren't there in-house on a 24/7 basis. And if you ask nurses working in a nursing home, they will always agree that part of their job is to act as the eyes and ears for the doctors when they aren't there, and that part of their job is to alert doctors when there's a changing condition for one of the residents who the doctor cares for. And when it comes to UTIs, it's their job to, one, recognize when a resident is showing signs of an infection, and two, to alert the doctor that this is happening. They don't need to be able to diagnose a UTI, they don't need to know what bug is causing it or how to treat it. Just spot the signs of it and let the doctor know. Once the doctor knows that one of their patients is showing signs of a UTI, they have three options. One, issue orders over the phone. Two, come in and see the patient. And three, order the patient sent out to the hospital. In this case, that worked just fine. The nurse recognized the patient was showing signs of a UTI and they called the doctor. In response, the doctor issued two orders. The first was that he prescribed an antibiotic. The other was that he ordered a urine culture and sensitivity test. Let's talk about the urine culture and sensitivity test first. There's actually two aspects to it. The culture portion of the test takes a urine sample and determines whether there's bacteria in the urine and what kind. It confirms that there's an infection. The other part of it is the sensitivity test, and this measures which antibiotics the bacteria is resistant and susceptible to. In short, it tells you which drug will and won't work against the bug that's causing the infection. If the bacteria is resistant to the antibiotic, it tells the doctor that he needs to change the antibiotic. If it's susceptible to the antibiotic, it means the antibiotic should work against the bug that's causing the infection. Here, the antibiotic that had been prescribed was a common frontline antibiotic, which is commonly used to treat UTIs. And it may seem strange to order an antibiotic without knowing it'll work, but that's actually the common practice. Doctors order the drug with some basis for believing that it'll work and then make adjustments if needed. That way, the patient gets the benefit of the drug while waiting for the results of the test, which can take 48 to 72 hours. In this case, the results of the culture and sensitivity test initially came back to the nursing home, but not the doctor's office. And what did it show? It showed that the bacteria was resistant to the antibiotic that the doctor prescribed. So what was the role of the nursing staff when they got back an abnormal lab? We spoke earlier of the role of the nurses as the eyes and ears of the doctor, and it was the job of the nursing staff to call up the doctor and say, hey, we just got back the result of this test and the bacteria is resistant. What do you want to do? But that wasn't what happened. Instead, when the report went to the doctor's office the following day, the doctor changed the antibiotic to one which she knew would work based on the test results. In short, there was a 24-hour delay in getting a drug that worked to the patient because the call to the doctor saying that the drug that was prescribed wasn't working didn't happen. But before the patient could get the antibiotic that actually worked, she slipped into septic shock, had to be hospitalized in the ICU for nearly a month. Did that delay make a difference? We had an infectious disease expert who was prepared to say that it did. I'm sure that the nursing home would have had someone ready to say the exact opposite. And that was why it made sense to get the case settled and get some money into the hands of a client who was in her mid-80s. The exact terms of the settlement are confidential, as is the identity of the nursing home involved, but we had a client who was very happy with the outcome. And if you think that was interesting, check out this one here.